Thank you. Distinguished guests, members of the press, let me also take this opportunity to congratulate truly the Nigerian government. The Nigerian government, from the highest level of the state, of the country, have shown exemplary leadership. We have witnessed an effective COVID-19 response in this country. A catastrophe was predicted. A doom was predicted. We did not see it because Nigeria was among the first countries to really impose courageous public health and social measures. This is what allowed us to get on top of both the first wave and now the second wave. That's why we are really happy to have this additional tool, the vaccine, which will help us accelerate the end of the acute phase of this pandemic. But let me take the opportunity to remind all of us that it will not be vaccine alone. Until everybody is covered, we will still continue. We will need to observe public health and social measures. We need to deny this vaccine the opportunity to further multiply and mutate to create variants of concern. WHO, together with the other UN agencies and partners, we are here to support that effort until such time that COVID-19 will be history of the past. Thank you.
Thank you very much. Quickly, I'd also like to say that Nigeria has always been the forefront of fighting not just epidemics, but also we will fight and ensure that we nail the coffin of COVID-19. I want to hear an amen there. And I know I can see that members of the Rotary Club are also present here. You are all very welcome. You did a good one with polio. We hope that together we will fight COVID-19. I'd also like to recognize that we have the Permanent Secretary, Federal Ministry of Health here with us. Please, shall we put our hands together for him? We are moving on steadily as I now invite the man who has, and his team, his able team, that have all been able to put all this together. Before he comes and I bring him to the microphone, shall we please all appreciate members of the team led by the National Primary Healthcare Development Agency. The government spoke to bring in the vaccines in, and we are flagging it off here today. So welcome with me the Executive Director, NPHCDA, Dr. Faisal.
The Speaker of the House of Representatives, the President of the Senate, hereby represented by the Chairman of the Senate on Health Services, the Chairman of the Presidential Task Force on COVID-19, and the Secretary to the Government of the Federation, the Honorable Ministers of Health, distinguished ladies and gentlemen, permit me to rest on already established protocol. On behalf of the team at the National Primary Healthcare Development Agency and the partnership, it gives us great pleasure that we're witnessing what is, without a shadow of doubt, a watershed moment in our lives. I want to first and foremost recognize the untiring efforts of the Chairman of the Presidential Task Force on COVID-19. Without his leadership, we wouldn't have been here today. Please, can we give him a round of applause? Your Excellencies, distinguished ladies and gentlemen, our being here today has been also because of the leadership that we've been able to follow, the leadership of the two Ministers of Health and the Permanent Secretary of the Ministry of Health. Can we give them a round of applause? Can we give a final round of applause to the men and women who have worked so tirelessly to make sure that the numbers of people who died from COVID-19 in Nigeria are the BRS minimum. Today, we're going to be administering the first dose of the AstraZeneca vaccine to a frontline health worker. By doing this, we're symbolizing what we've been saying for the last few weeks from the Presidential Task Force on COVID-19, that we're going to be prioritizing those who in the last 1 year have sacrificed on behalf of all Nigerians to make sure that those of us who contracted the disease are treated in a humane way, are treated in a way that really replicates the best traditions when it comes to the quality of medical practice. Today, we'll be administering the vaccine to a medical doctor who has been in the front line in the treatment center since March of 2020. Can we give Dr. Cyprian a round of applause? We want to appreciate the CMD and the board of directors of the National Hospital for providing us with this environment. I want to, on this platform, wrap up by saying we've said it long before now, that it is not how fast, but how well. It is not how fast we get the vaccines here, but making sure that we get the right vaccines for our environment, getting the right vaccines that are suitable for our cold chain infrastructure. Earlier today, we got the news from our sister agency, the NAFDAC. The DG NAFDAC is here. Her team worked tirelessly over the last 48 hours to do the final checks to the vaccines, and she gave us the good news that apart from certifying that these vaccines are safe, they've done the final checks and we can go ahead with the vaccination. Can we give NAFDAC a round of applause? We took all of the measures that were required, more measures than many countries took when it came to selecting the vaccines for Nigerians. Yes, there was a lot of talk about the delay. Yes, there's a lot of talk about why we're not starting when other countries were starting. But we realized that it is more important that we got WHO emergency use listing, that we also looked at some of the more stringent regulatory agencies before we finally asked NAFDAC to assess the vaccines. They've done all of their work, and I want to put it on record again that the vaccines that we're going to be delivering today to Nigerians are safe, they're effective, and we're going to roll out this vaccine in a very efficient manner, just like we all worked together as one country and defeated the wild polio viruses. Today, it feels proud to be a Nigerian. All of you should be proud that finally we're taking that determined step to turn the corner when it comes to finishing the job of controlling COVID-19 in Nigeria. Thank you very much. God bless you.
Thank you very much, Dr. Faisal. I can understand the excitement around here, but more reassuring is the fact that these vaccines are NAFDAC certified, and it means that they are efficacious, they are good, they are potent for us here in Nigeria. Another round of applause for the work that has gone to this. At this point, I'd like to invite the Honorable Minister of Health, Dr. Osagie Ehanire, who I'm sure, if his birthday is not today, is a very happy man coming here. So, can I invite the Honorable Minister?
Your Excellency, the Speaker of the House of Representatives, Your Excellency, your distinguished Senator Olori Egbe, here in his own capacity and representing His Excellency, the President of the Senate, the Chairman of PTF, and Secretary to the Government of the Federation, and our landlord, the Honourable Minister of the FCT, Honourable Minister of State, and Royal Fathers here present, Permanent Secretary, our development partners, Chairman of the Board of National Hospital, and CMD and staff. We thank you all for accommodating us here today. The long-awaited day is here. on which Nigerians can now join others in the global community to be vaccinated against the dreaded COVID-19 virus. For us in the health sector, it is a relief and the marking of the start of a tedious but hopeful exercise to see our fellow citizens develop immunity against this virus. As has already been announced, I am happy and also relieved again to announce that at 12 minutes past midnight today, I got the text message informing me that NAFDAC has certified this vaccine for use. Otherwise, we would not be sitting here today. It will have to be postponed. It has been a harrowing past 1 year to helplessly follow the gradual increase of COVID-19 casualties in our country, especially among health workers in our midst, which was also depleting the human resource for health and making it all the more harder to tend to other people in need of health care. Every life lost to this pandemic mattered, but the loss of health workers compares to soldiers lost at the war front and is therefore laden with sentiment. The vaccination campaign we kick off today will be in 4 phases and will align with the planned arrival of vaccines in batches. Each phase targets a specific segment of our eligible population to ensure equity in the vaccine deployment. The defined frontline healthcare workers are prioritized globally for vaccinations against COVID-19 due to their higher exposure to the risk of infection with COVID-19 in the course of duty. It stands to reason that this protection is not only for their own sake, but also for our own sake, since any one of them absent due to illness means, again, a depletion in their ranks and can forebode staff shortage. It therefore makes sense to cater first to those who cater to us. The next prioritized group are those who, if they become infected, are at higher risk of severe disease. These are the elderly and the vulnerable, as defined by presenting with pre-existing conditions like obesity, diabetes, chronic kidney, respiratory, and heart disease, and cardiovascular diseases and other medical conditions as identified by their doctors. Ladies and gentlemen, all eligible groups must get vaccinated as and when due, while the non-eligible groups should respectfully await their turn. The vaccines are more than enough to go around, and they'll be coming in phases. Persons under 18 years and pregnant women are for now not eligible except they have been medically certified as vulnerable due to one underlying ailment or the other. The reason for them not being generally eligible now is because there is no scientific assessment yet of the safety for persons under 18 years old of age and pregnant women. That said, let us encourage the elderly and those with known underlying illness to be vaccinated and so to shield the community, the loved ones and ourselves from COVID-19. We have taken steps to ensure vaccine security and accountability, but we must also warn against any kind of foul play or underhand dealing in this exercise. Any infraction will embarrass us and will be sanctioned swiftly. This campaign must be done according to the books, which have been so elaborately put together by the Ministry of Health and the National Primary Healthcare Development Agency. So I urge citizens to be vigilant and to report any unwholesome practice or attitude to the police or to the Federal Ministry of Health. These vaccines are our common assets, and the responsibility is on every person to protect them and ensure proper use. The Federal Ministry of Health and NPHCDA desire an impactful and successful vaccination campaign. It is important that all sectors key into the federal government's homegrown strategy for the COVID-19 vaccination, which is known as the TEACH phenomenon, and the Electronic Management of Immunization Data System, EMID. I urge all states of federation and the FCT to align with the initiatives in order to have a peaceful and orderly campaign across the country. I want to use this opportunity to thank the dedicated staff of the Federal Ministry of Health, led by the Permanent Secretary, Mr. Abdulaziz Mashi, the NPHCDA, led by Dr. Faisal Shuab, and particularly our donors and our partners who have walked this very hard way with us. I also remember recognized members of the UN agency who have always supported us with their single basket idea, and also with the technical support they have always given us. Worthy of recognition must be the vibrant members of the media who I see arranged right in front of me, almost more than the number of us sitting on this side, who have done their duty by following developments in the health sector since COVID-19 broke out in February 2020. Today is primarily a day for vaccinating our healthcare workers. I want to tell you that we are very proud of you all and wish you well and urge you to continue to give your best to the country and to fellow men, whatever the circumstances. Despite the beginning of this vaccination exercise today, I would like to emphasize that we are not out of the woods. Yes, there is light at the end of the tunnel, but we are still in the tunnel. We are not out of the tunnel. We need to continue as strictly as before with the non-pharmaceutical interventions, the public health measures, the wearing of masks, even if you have been vaccinated, the social distancing, the avoidance of crowd, and all the use of sanitizers and measures that have been expressly sung over the months, in order to have the full benefit of this exercise. We are aiming for herd immunity. We are aiming to vaccinate 70% of the population. We are also aiming to look after the interests of our neighboring states in the West African sub-region, with whom we have a lot of human traffic. Because, as has been said by the Director General of the World Health Organization, no one is safe until all of us are safe. Thank you for your attention.
Thank you very much, Honorable Minister. I think he has highlighted the need for us to continue to adhere to the COVID-19 protocols. He has called for working together and be responsible, and has assured us that it is a win-win game. Get vaccinated, speak about vaccination to other people. And I was also told that it is free. It is administered free by the federal government. So let's put our hands together for this. In the name of collective responsibility, our next speaker, the Right Honorable Speaker of the House of Representatives, Right Honorable Femi Gbajabiamila, will address us now. And I hope that the media crew from the Speaker's office are ready. Our next VIP to speak to us on this historic day, where Nigeria has joined the global effort to rid us of COVID-19. I hope that we'll put that together as we listen to him. While that is being done, let me just say that 4 medical staff will be here today to be administered the vaccine. These are men and a woman that have risked everything. They're married, they have children, but that for them is not the concern. The concern is for them, you know, to ensure that they save more lives. Okay. I've just been informed that the order has to be reordered. So I seek the indulgence of everyone around, Your Excellencies, very distinguished ladies and gentlemen. You'll all agree with me that the federal government has taken the containment of COVID-19 very, very seriously, putting it at the office of the Secretary to Government of the Federation, who also is the chairman, PTF, on COVID-19. He came here right on time. That's to show the seriousness for which the government or this administration has taken the containment of COVID-19. And so, on your behalf, Your Excellencies, all very distinguished ladies and gentlemen, and of course, members of the Nigerian vibrant media, I'd like to invite the man of the moment, Boss Mustafa, to please address us.
Well, some of us are laterally endowed. Your Excellency, the Speaker of the House of Representatives, the representative of the Senate President, Chairman, Senate Committee on Health, members of the Federal Executive Council here present, permanent secretaries, our development partners, chairman and board members of the National Hospital and Management, the executive director of the National Primary Healthcare Development Agency, our health workers who started out as our first line of defense and later became our last line of defense. Distinguished ladies and gentlemen, gentlemen of the press, today marks another great milestone in the response to COVID-19 pandemic in Nigeria. We have every cause to be hopeful and more determined to win this war. The human activities that culminated in the arrival, authorization, and distribution of vaccines have shown that humanity, when working for a common goal and unity of purpose, possess the capacity to achieve a lot. This is more so because the virus spread around all countries and territories of the world with alarming speed, recorded millions of fatalities and infections without discrimination on the basis of sex, creed, tribe, language, and even status. For us in Nigeria, and indeed nations of the world, the lessons to be drawn from this lack of discrimination by the virus are numerous. They include the fact that we must approach the vaccines phase with unity of purpose. 2, we must understand that nobody is safe until everyone is vaccinated. And 3, we must recognize that vaccine hesitancy will impact negatively on our lives and those of our loved ones if allowed to foster. 4, we must demonstrate at all times that this is a war of MPIs plus vaccines for the survival of everyone. And 5, we must believe our government on the safety and efficacy of the vaccines brought to Nigeria. And lastly, we must support the planned and systematic rollout of the vaccines and mobilize our citizens as we move into the states. In keeping with our promise, the Presidential Task Force is prioritizing the frontline health workers in the first batch of vaccines received. They have fought hard to save us. They laid down their lives for us, and in the ICUs and treatment centers, they became our last line of defense. On behalf of the President of the Federal Republic of Nigeria, the government and the people of Nigeria, I salute our heroic frontline medical personnel for their professionalism and commitment to saving lives. This ceremony is just the beginning of a well-detailed vaccination plan that will reach every eligible Nigerian at the appropriate time over the year 2021 and 2022, when we hope to have covered over 70% of Nigerians and achieve herd immunity. The vaccines will be arriving in batches, and I urge all Nigerians to be patient with relevant agencies of the federal government and subnational entities managing the deployment process. This is a novel rollout, just like the virus was a novel virus. Let me state categorically that vaccines are very sensitive, life-saving commodity, and the only authorized source is the federal government that has signed indemnity with the manufacturers. I therefore appeal to all Nigerians not to patronize fraudsters who are out to defraud, get rich, and in the end, endanger your lives. We must all be vigilant. On behalf of His Excellency the President, I now have the single honor and privilege to flag off the vaccination of eligible Nigerians against COVID-19, beginning with the frontline medical workers to the glory of God. And I thank you for listening.
Thank you very much, SGF and Chair PTF COVID-19. I just want to say that we're just not dependent on things that are being brought to this country. We are also intensifying in-country production, particularly of the non-pharmaceuticals that we use, the hand sanitizer. This hand sanitizer, sir, is produced by the National Hospital, the pharmacy department, and I think they deserve a round of applause because purses are getting leaner, so we need to start looking in-country to get things done. We'll continue. I'm getting all kinds of good news coming on, and as soon as I'm able to put them all together because of time, I'd also come speak to the public about it. But in the interim, it's good to know that our lawmakers have also identified with the drive to contain COVID-19 in Nigeria. So at this moment, Your Excellencies all, very distinguished ladies and gentlemen, and members of the Nigerian Vibrant Media, I'd like to invite to the microphone the Honorable Speaker, Honorable Femi Gbajabiamila, to please address us.
the Senate and House Committee Chairman and members of the National Assembly here present, the Secretary to the Government of the Federation and Chairman of the Presidential Task Force, the Federal Capital Territory Minister, Health Ministers, DGs. Allow me at this point to stand on the existing protocol, and of course, ladies and gentlemen of the press. Let me first start by very quickly putting it out there that as you can see in the program, I'm just here to observe a very epical moment in the history of Nigeria, in the history of the world actually, where we seek to inoculate almost 200 million people in this country. That's why I call it epical. It's been one long year of torture, of sadness, of a change in lifestyle from what have already been established as our lifestyle. In doing that, let me thank the SGF and his team, because we have to remember how we got here, because we're very quick to forget sometimes. It's been about a year now, and the President put together a team led by the SGF and supported very, very ably by the ministers, the relevant ministers, and health personnel. I want to thank you and your team for what you have done and how you have led us to this point. I remember that time a year ago when the whole of Nigeria witnessed a daily briefing from the SGF and his team. I emphasize the word daily briefing because it's not a mean feat to sit down or to stand out there every single day and keep Nigerians abreast, transparent to Nigerians, briefing with facts and with truth. And whilst we like to compare ourselves with other countries that are well organized, we saw how they did their daily briefing and how in a matter of 30 days, a month, they had to stop. Not because they didn't have the capacity, but because it was so difficult to keep abreast with the way this thing was ravaging the world. The way the virus was mutating and there were just different things were coming up. They stopped. And I'm talking about America. But our SGF and their team continued on the daily to brief us, to answer questions. And I think that is commendable and deserves another round of applause. Thank you very much. I must also thank, on behalf of the National Assembly and therefore on behalf of all Nigerians that we represent, the health workers. The health workers have been the major, should I say, source of success for where we are today. For a country of almost or over 200 million, yes, many will say, oh, we don't have reported cases, we don't have statistics. But even with the statistics we have, 200 million people, and to record the number of deaths that we have, I think the health workers have done so well. They've put their lives on the line, and they have manifested what it is to be a true Nigerian. The can-do spirit that many of us often forget that we have in this country. And I think they deserve even a bigger round of applause. So we're now a year in, and we've started our journey to recovery, to reach a level of herd immunity that we all seek or we all long for. In this journey, let me very quickly preempt our journalists. We're a country of 200 million people or thereabouts. Whilst I expect the journalists and the press to continue to play their very important role of checks and balances, I want to please implore and charge and ask that we do it with a sense of responsibility in our reporting and not give to unfounded rumors. And this is a time for us to rally behind the government, because like the SGF said, the virus knows no creed, knows no religion, knows no ethnicity, knows no sex, knows no age. So it is time for all of us to come together as a country, because as I've often said, we're actually in a war, but in a war with an unseen enemy. And therefore, when a country goes to war, you go as one. So I want to implore the journalists, I want to implore Nigerians out there, not to give in to conspiracy theories, because we will hear them. We will hear conspiracy theories. There will be stories about, no, this virus is better than, this vaccine is better than that one. No, it's no. Vaccine is a vaccine is a vaccine. There are so many out there, Moderna, Pfizer, AstraZeneca, which is what we have today, that will do the job. And so we should encourage the government in providing and rolling out more and rolling out as many vaccines as possible. We have about 4 million now, and there's many more coming. The rollout plan is just as important as the vaccine itself, and that's what we should do. Even in countries where they have fewer in terms of population, they have issues with rollout because this is new. And so we will need the encouragement of the Nigerian people. We must not play politics with vaccine. We must not play politics with the health of our neighbor. We must be on the same page, whilst we also correct and do what you need to do in terms of your role in checking the government and holding the feet to fire, their feet to the fire. We must do it with acute responsibility. From my understanding, the vaccine has a 12-week in between the first and the second dose. And from my understanding, the longer that interregnum, that period of between first and second, the more effective the vaccine is. From the research and the questions I have asked, AstraZeneca has been proven. Some people say it's 60-something% effective. Well, if it's 60-something percent effective, I have asked questions as well. But apparently, it's because it was the last, one of the last to come out just before the Johnson & Johnson. And by the time it gets to 12 weeks after the first dose, it gets to the stage of 90-something. That's when it hits the 90-something percentile, from my understanding. But whatever the case is, I'm sorry? Yes, I mean, the chairman, Senate Health Committee just said I was applying for Masters in Public Health. Well, I'm sorry, the issue of, what do you call it now, the issue of this virus is not the exclusive reserve of you doctors. This is public health that concerns all of us. And I can tell you that some of us are so concerned, even the man out there, that you'll be surprised that he knows more than you. Because this involves lives. Maybe some friend or some relative has dropped dead. So we do our research, but I still give deference to your professional knowledge. I think I owe it to the Nigerian people to also educate a little bit on the full implication of vaccination. I don't want us to go away thinking once you've been vaccinated, that's the end of the story. Like was said earlier on today, no, that's not the end. That's just the beginning of the journey until you take your second vaccination. But even then, we have to be mindful of the person that has not been vaccinated. So my understanding again is that once you've been vaccinated, you develop a level of immunity and you cannot be sick again. But from my understanding, whilst that can happen, the virus can still come into you, but it's ineffective in you, but you remain a carrier. You still carry the virus. Am I correct? So, if that be the case, for those who are lucky to get vaccinated early enough, understand that whilst you are safe, you may still be carrying the virus, and so you need to protect your neighbor. And so you need to continue to wear the mask. You need to continue to observe those protocols that were followed for a year, as inconvenient as it may be. You need to continue to wash your hands. You need to continue to wear your face mask and wear properly, except when you're speaking at a podium. So for me, it is important to send that message, that message to Nigerians that even though you've been vaccinated, you must continue to observe that protocol until we'll achieve that level of herd immunity. So I want to thank everybody once again. I want to thank the people who put this together. God bless you all. Thank you very much.
I'm ensuring that I'm putting on the sanitizer. Mr. Speaker has spoken without his mask. So I'll be very careful to hold on to the microphone. But having said that, I think the seriousness of it all is the fact that even WHO has announced that infodemics, which is all conspiracy theory, kills even faster than the virus itself. So I'm sure that my colleagues here are responsible members of the vibrant Nigerian media, and will do justice to what we are gathered here to do. So let's now hear from the representative of the Senate President, His Excellency Senator Lawan, ably represented today by the Chairman, Senate Committee on Health, Senator Ibrahim Oloriegbe. Senator Dr.
The Speaker of the House Representative, my brother and my leader, Right Honorable Femi Gbadagbe-Amila, the Secretary to the Government of Federation and Chairman PTF, whom we have all collectively, including the Minister, be awarded Masters of Public Health honoris causa, isn't it? So I can assure you of that it's been granted. Honorable Minister of FCT, Ministers of Health, Development Partners, Head of various agencies here, I stand on all existing protocol, but I recognize the members of the media here. I wouldn't have to say anything other than to say I rise to second and adopt what has been said by the Right Honorable Speaker. And so I said, as such, because I think he has said all he has to say. Other than to say that the President of the Senate wished to be here. In fact, yesterday we had discussion when he gave me the mandate to represent him. As the Speaker has said, with his invitation that he does say we have to give a speech, and I don't have his speech. That's why I have the liberty to adopt what has been said by the Honorable Speaker. Thank you all, and God bless.
All right, thank you very much. We will now move on to the vote of thanks, and you can see that this is a bit changed on the agenda. We'll take the vote of thanks so that we can draw attention to what actually brought all of us here today. After the vote of thanks, my colleagues, by the Honorable Minister of State for Health, we will move now to the vaccination center. What do you want? I'm not... Okay. All right, this is democracy. This is democracy, and the SGF has agreed to this, and chairman of the PTF, so thank you, sir. All right. Please, before we start, I have appealed to my colleagues, particularly the still photographers. Please take your positions. You are already there. Please be seated. Thank you. This is historic, and everybody wants a vantage position. Thank you. As we kick off this flag off, it is important to note that the agency responsible for vaccination of all Nigerians is the National Primary Healthcare Development Agency, ditto State Primary Healthcare Development Agency. It is in the reality of this that Your Excellencies, all very distinguished ladies and gentlemen, I would invite the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, who will be the person to administer the first vaccination on one of the frontline health workers. Let me just say here that please may I ask that we all leave so that we can capture every moment of this historic time. I'm sure we all can get our shots. They're not translating, it's action. The first Nigerian ever to receive this vaccination is Dr. Cyprian Ikong from the National Hospital. I was reliably informed that he has been at the isolation center from March 2020 when this pandemic broke in Nigeria. Done.
So I just wanted to take the opportunity to show that with this vaccination card, we also have a QR code. This is one of the requirements of the Presidential Task Force, so that if anybody needs to travel out of the country, once this QR code is scanned, it brings up the information of Dr. Cyprian, so that it shows exactly what vaccines he has taken, the AstraZeneca vaccine, when he took the first and the second doses, okay? And it will also show his photograph. So this is also an electronic card, as it were, because of the QR code. This card also contains the exact batch number of the vaccines that he has taken. Thank you very much.
Thank you very much. Historic moment. Dr. Cyprian, thank you for your sacrifice. The next recipient is Dr. Joseph Nuru. Tahir, sorry. Okay. The next doctor to be vaccinated is Dr. Tahir Yunusa. Dr. Yunusa today has saved on record 10,549 patients. He has seen more than these, but saved the lives, and I think he deserves a very loud round of applause. The Gwagwalada Isolation Center was the first isolation center, and we're still counting, but just before we started this, he said to me that that center has saved 10,549 lives and still counting as we speak. Let me also say that with this exercise, more health workers are being trained so that they are perfect at what they do, not just here in Abuja, but across the states. Okay. Our nurses have been trained, and they are doing what they know how to do best. Thank you. Can we have Dr. Joseph Nuru? Oh, okay, for now. I've been told that the vaccination will continue. But can we have the nurse? Can we have the nurse? So that it's not just doctors. Yes, sir. Can we have the nurse, please? To show that men and women.
Yes, they should have the nurse.
The nurse, yes. Can we have the nurse to be seated, please? The nurse, this vaccine has no gender barrier. Let doctor.
One of them. The last doctor. Let's call the last doctor.
Let's have the last doctor. The last doctor, please. Thank you very much. Your Excellencies, all very distinguished ladies and gentlemen, may I please call on the Honorable Minister of State for Health, Senator Dr. Mamora, to move the vote of thanks. Huh? One person, okay. Do we have a recipient who would want to speak before the vote of thanks? Yes. Quickly, please. Thank you very much. Okay.
It's not supposed to be that. Anybody that takes vaccine should rest.
Okay.
Doctor, go and rest, please.
Okay.
His full name.
Tell us.
Your full name?
Tell
Okay.
us your name and go and just
Okay. All protocols duly and respectfully observed. My name is Dr. Cyprian Ngong. We've been at the forefront of the COVID-19 fight here in National Hospital, our isolation center, under the able leadership of the National Hospital. They've provided everything we need for this fight. We've lost some, we've got some, and we are happy we are getting the vaccine now in Nigeria. I think that is about the best news we've had since. I only wish my dad had had that vaccine maybe months ago or so. We lost him, but we thank God. And the fight is still on and we will win. Thank you. Well, you can see I just took the vaccine now, and I feel good. And I have dreamt of taking this vaccine, and I have taken the vaccine today. Thank you very much.
Thank you. Thank you very much. I'm sure if we take a quick census here, a lot of us would report that you've lost either a friend or a family member. May their souls rest in perfect peace, and may the fight to contain the pandemic be realistic for us in this country. Please, I'd like to call on the Honorable Minister of State for Health to please move the vote of thanks. Sir.
Thank you very much, Moji. Your Excellency, Mr. Speaker, the People's Speaker, thank you very much for being part of this. The SGF, who incidentally is the chairman of the Presidential Task Force that has led the response activities thus far. And of course, we have to confer on him public health expert, because he has done so well. Our host, Minister of FCT, and my colleagues in the cabinet, and our royal fathers here present, and the media, thank you very much for what you have done. Now, this is the day we've been waiting for, and now we have seen it happen in terms of the vaccination of some frontline health workers. Three messages have resonated from day one that the pandemic broke out. First is the message of national unity, and that is what has brought us thus far. We are united against a common enemy. The second is the message of global solidarity, and it's that message of global solidarity that has got us the vaccines we are using right now through the COVAX facility. The third message is that of message of hope that tomorrow will be better. And we are seeing it on a daily basis that tomorrow is getting better and that we will overcome. I cannot but lend my voice to what has been said in terms of conspiracy theory. It is fake news. Please be ye warned. Don't be surprised if somebody is peddling that rumor and that person might have taken the vaccine long time ago, like it happened. You all know where I'm talking about. Please don't be fooled. This is the best that we can hope for. In a pandemic situation, the ultimate is the use of vaccines. That is the ultimate, and that's where we are right now. So, in the struggle, in the response activities so far, so many people, we thank God that we are alive right now. I cannot but say it again, that those who peddle fake news about conspiracy theory, what they are doing is a kind of desecration of the memories of those who are dead already from this pandemic. Secondly, it's a disservice to frontline workers who are taking their lives So we should not give in to that. So I want to thank our partners, international and local.
Behind you.
I want to thank CAR COVID in particular and all other donors that have been part of this. But I cannot but thank our President Muhammadu Buhari, who has given every support, and I mean every support needed to get us to where we are today. I want to thank all the frontline workers and all other workers in the health sector that have been part of this. I want to thank all the arms of government, particularly the legislature, that has always approved what is brought before them in course of our fight against this, both in the House of Representatives and of course the Senate President, the Speaker. Thank you for your support, and of course the committees of health of both houses. I want to thank the media. The media, you have done excellently well. But for you, you can't light a candle and put it under the table. It has to be on top of the table, and you have been the candle that shines the light of what we do. I thank you so much. I want to thank the cleaners who work in the hospitals, particularly in the ICU, in every other place. I thank the cleaners. These are people behind the scene. We hardly see them, but they do so much to keep us all safe. I want to thank the ambulance drivers. Thank you so much for what you do. I want to thank the ward maids. All of you have been wonderful. Even the technicians that work in the hospitals. You sort out the issues of light, the issue of water, name it. I thank you so much. I thank you so much. And I have to do this because it's in line with that saying one English writer said that gratitude is not just the greatest of all virtues, but the mother of them all. So we are grateful to you all. Thank you very much.
Indeed, gratitude is important, and I'd like also to add my voice to appreciate the traditional and the religious institutions that are present here. Before we finally take our leave, I'd like to ask members of this side, the front row, to please have a group photograph with able medical frontline medical workers that were administered the vaccine. And whilst we are there with the group photograph, we'll take the national anthem. And I want to thank you, all of you, and I hope that it will spread the good news of the fact that Nigeria is on the...
So we're still live at the national flag-off of the COVID-19 vaccination program here at the National Hospital. This is the first vaccination site, and this is actually quintessential and fundamental for Nigeria to ending the COVID-19 pandemic. We're here live, and they're about to use this space for a photo shoot between all the dignitaries. So in a few minutes we will be talking to one of the first recipients right now. Okay. So, can I just move the camera over here? Thank you. Okay, so we have this way, please. All right, so we have one of the first recipients with us at the vaccination site. You received, thank you for joining us, by the way. You received the jab a few minutes ago. Can you tell us what it feels like?
My name is Professor Yunusa Tairu. I feel great to be among the first, number second, to actually have the second person to actually have this vaccine. So I feel great, still elated, and it's a dream come true. We've been waiting for this vaccine, and it has finally come. So we thank God.
What does this mean to you?
I want to take photograph. Okay, it means so well. It means so nice. I mean, it means so good, and I think let me just join them. I'll join you back now. This is great.
Thank you very much for your time, though. So the program is about over. We had various dignitaries come around, the Minister of Health, representatives from the National Assembly, we had the Secretary to the Government of the Federation, all here, and of course representatives from the UK, the EU, all here to witness the Nigerians' vaccination initiative. And of course, Nigeria is about the third African country to receive from the COVAX facility the COVID-19 vaccines. And this means a lot because it's one step towards ending, one critical step towards ending the vaccination, the COVID-19 pandemic in the country. We'll be right back after now.